So anyway, now I would love to introduce to you Dr. Karin Dina. Dr. Karin is actually an instructor here at Living Light. She teaches the Science of Raw Food Nutrition course with her husband, Dr. Rick Dina. Dr. Karin has been studying and practicing raw food nutrition since 1990. Her credentials include an undergraduate biology degree, 2.5 years in the naturopathic medicine program at Bastyr University, and a doctorate degree in chiropractic, all with honors. She is now teaching raw food classes, raw food nutrition classes full-time in various capacities. And Rick and Karin teach the acclaimed Science of Raw Food Nutrition course right here at Living Light in Fort Bragg. So most of our students do take that course, and many of them come back and take the educator training as well. So they have a full raw food nutrition educator course, and I'm sure she's going to tell you about that. They're also working on their first book and many other raw food educational programs. So without further ado, please help me welcome Dr. Karin Dina.
It's going to take another minute for my computer to do its thing here. How's everybody enjoying the Expo?
That's good.
Excellent. That's good. We get to learn about digestion today. And I've been doing quite a bit of research on actually mood and how our mood affects digestion. So a lot of this talk is going to be focused on the mind-body connection and how it affects digestion. Because a lot of people like to talk about digestion in food and how food affects it. And it's very true that food can have a rather significant effect, but one interesting thing that I found is that more than anything else, how you are feeling has a lot to do with it as well. Now, let me just pull up our PowerPoint so I can show you some cool pictures. And we will get started. I apologize for being a little bit late, but I was over at the Ask the Experts panel and they let us out late. So let's see here. Get this taken care of. Here we go. All right, perfect. Should be ready to go up on the screen. Technical difficulties?
Assuming the projector actually wants to.
You just turned it off. You turned it on again. It's off.
What now?
You're going to have to, what you need to do is you need to just hold it down for a second, and it takes a couple of seconds for the light to come on. That's generally how it works.
The light usually comes on at the back.
It usually takes about 5 to 10 seconds for the light to come on after you press the button.
Well, yeah, I just wanted to see
It was on before.
I know, I turned it off because the other classroom,
Okay.
it was projecting the other classroom, and I didn't want to have that behind Sherry while she was talking.
Well, hey, in the meantime, if you all could maybe come a little closer. I guess it's not really that essential, but I have some really fun pictures I want to show you. It's kind of a bummer that this isn't going to work out. Darn.
It'll work.
Okay. All right. Well, hey, let's get started anyway. And when we get to the point where the pictures come up, hopefully we will not be experiencing technical difficulties. So this talk is creating optimal digestion. And like I said, there's so many different things that go into creating optimal digestion. One of the big things in the raw food community is food combining, for example. I'm sure you've all heard of that. Maybe some of you haven't. The idea behind food combining for optimal digestion is that you eat food in certain combinations to help your digestive process work better. One of the tenets of that is to not consume fruit with anything else except for maybe leafy greens. And that is one thing that I've noticed to be true over the years. And yes, your light is on now, so that's a good thing. As far as science behind food combining, there actually isn't much at this point, but we'll address that later in the talk. Now, there's a lot of different aspects to digestive health. Number one, what you eat, your diet, what you choose to eat. I'm sure that you know that certain types of foods have a tendency to either be beneficial for digestion or can be problematic. When you eat, what time of the day are you eating? Are you eating late at night? Some people notice that when they eat late at night, they wake up in the morning feeling a little bit groggy. It is true that when you eat later at night, then you have a tendency to not get a full night's sleep because you are digesting while your body is trying to rest. The next one on our list is how you eat it. What context? How are you feeling while you're eating it? What's your state of mind? That's a really important one, and that's one that people don't necessarily think of. In our culture, being as harried as it is, oftentimes people don't take the time to relax while they're eating. And as it turns out, they might have problems with their digestion because of that. And then there's a lot of health challenges that can affect digestion too. So like I said earlier, I'm going to talk mostly about how our mind affects our digestion. And this is a connection that has been very well known by science for quite some time. Oftentimes in peer-reviewed literature and in popular literature, I hear this referred to as the so-called mind-body connection. And it is literally a connection between our mind and our body. And the way that that connection is achieved is through our nervous system. In other words, our brain, or our so-called mind, however you want to see that, actually communicates with our body through our nervous system, and vice versa. And here's a photo right here of our nervous system and our brain. So up here we have our brain at the top. Let me get my little pointer out. There's our brain. Let's see, are we working here? There we go. Yeah, okay, all right, my pointer does work. There's our brain, here's our spinal cord, and then there's a bunch of different nerves that come out of our spinal cord and go to different parts of our body. Makes sense, right? We all know this. One thing that our body is very good at doing is responding to what our brain says. In other words, if I want to use this pointer, I can very easily do that. My brain is telling my hand to go just like this, and it works just well like that. Another thing that our brain does is it tells our body, or should I say our heart or other parts of our body, to do different things that we may not necessarily be aware of them. As I'm standing here right now, I'm not telling my heart to beat, okay, but my brain is sending signals to my heart saying beat, beat, beat. But it's something that I don't have to consciously control. Now, as far as the nervous system goes, there's a couple of different functional divisions. Those would be the somatic and the autonomic. These are some technical terms. Please don't be intimidated by them. It's one thing I've noticed about science that can be problematic for some people is that it is a language unto itself. But when you push the language aside, you can see the more simpler concepts underneath. So I ask you to take a look at the simpler concepts. Now, the somatic nervous system is in charge of things that we can consciously control. In other words, movement of our hands, our feet, our head, chewing, turning of our head, all types of things, walking, running. That's all things that we can consciously control, and it's all things that we tell our body to do. So essentially, the somatic nervous system is involved in the coordination of voluntary movements. Next, the autonomic nervous system, on the other hand, is in control of the things that we do not consciously control. That would be things like our heart beating, our brain function. Just think about it. You don't tell your brain to think, it just does it, right? Down here also is digestion. When I eat something, I don't tell my stomach to start digesting. It just happens. It's something our brain tells our body to do. So this is the coordination of involuntary movements, the autonomic nervous system. It's also been called the automatic nervous system. Okay? Very easy way to look at things. Now let's take a closer look at the automatic or the autonomic nervous system. There's two primary divisions to it. Number one is the sympathetic. Number two is parasympathetic. You might be familiar with some of these terms. The sympathetic nervous system is associated with the fight or flight response or the stress response. So when you get all amped up or you're scared or you're under a lot of stress, that means that your sympathetic nervous system is in activation, and it serves a very good purpose. Many years ago when we were living in the wild, it was important for us to get away from danger. So the sympathetic nervous system plays a very important role in getting us out of danger. Very important. And then the parasympathetic is the opposite. That is in charge of rest and digest functions. Relaxation. It's very important. So the sympathetic and the parasympathetic work together. They're always activated, but oftentimes one is more dominant than the other. Here's an example of the sympathetic nervous system in action. All right? This dog over here, the poor thing is so scared. I saw this photo and I'm like, oh, geez, you know, it was just kind of, I feel sorry for the dog, but it's a good example of sympathetic activation. I mean, heck, if a German Shepherd came at me like that, I'd be like, you know, just like that too, you know. So anyway, sympathetic nervous system. Parasympathetic, on the other hand, here's my cat doing what he does best, okay? My cat eats a big bowl of food and he goes and he lays on his favorite chair and sleeps for about an hour and a half, okay? Rest and digest, that's what he's doing. So, parasympathetic nervous system. Sympathetic, parasympathetic. I have to say, though, I'm more sympathetic to the parasympathetic myself. Yeah. Anyway, so yeah, like I said, the two of them are activated at all times, but generally one is more dominant than the other, depending on your circumstance or your state of mind. Now, here's another interesting example. Let's just say that you are hiking in Yosemite or some other wilderness type of area, and you see some bear cubs playing, which I actually have in the past. I've seen little bear cubs. These two guys are playing around here. Now, let's just say, for example, that you see the mother bear. Yeah. You see the mother bear, and she sees you, and mother bears like to protect their cubs, and they see anything or anybody as being a potential threat. So the mother bear sees you. How are you going to feel? You know, you might start to think things like, you might start getting stressed out. You might have the desire to get out of that situation as quickly as possible. You know, your heartbeat may increase. You may start to perspire. I know I would. Stress hormones go up. Very important. And these stress hormones are responsible for getting your blood sugar to rise, so that blood sugar can go and feed your muscles in case you need to either fight or get out of there. Okay, so it's really important that you have this stuff going on in your body. Okay, so a lot of your energy resources are going to get directed to your muscles to allow you to get yourself out of this situation here. Very important. This is definitely not a time to be relaxed, because you definitely cannot negotiate with a mother bear. No doubt. All right. Now, some other things happen when you are in a situation where you're scared or you're under some stress. Right here we have our sympathetic nervous system over here on the right. Over here on the left we have parasympathetic. Now, when we are scared or we are under stress, we have inhibition of saliva flow. Okay, we know that saliva is where digestion gets started in our mouth. Other things that happen is that peristalsis and secretion of various digestive fluids in our digestive tract stop. You know, and this is important because our body is shunting energy into our muscles, getting ready to fight or flight. Fight or flee, I should say. Now, fortunately, it's your lucky day. The mother bear gets distracted by something else, some greater threat, and starts walking away. So you don't have to worry about her, and you can breathe a big sigh of relief and say, oh, thank goodness. So you go on your merry way, you walk down the trail, and you come to, for example, a kiosk or a ranger station, and you go inside. And you think, great, now I'm in a safe place. Now I can relax. There's no mother bear in here. I'm perfectly fine. So now your energy can start to be allocated to other things, like relaxation, digestion. So now would be an appropriate time to eat, and that would be fine because your stress is over. Your stress hormones have gone down, your heart rate has gone down, and your digestive secretions can start to increase. So, now that you are relaxed, your saliva can start to flow, peristalsis and secretion of digestive factors in your digestive system can start to work again, which is a good thing. The liver can start to release bile to allow for digestion of fat to occur. So those are important things that happen with parasympathetic nervous system activation. Very good. And under this situation, digestion is going to be much, much better. Now, how does this apply to real life? Think of people that you know, or think of yourself, somebody you know very well. In today's society, stress is extremely common. Not necessarily the type of stress that you would have if you had a German Shepherd barking at you or you had a mother bear growling at you. But nonetheless, some people have a constant low level of stress. And there's a lot of reasons why. Job stress, family stress, financial stress, there's so many of them. And it can be very challenging to find a place to relax or even the time to relax in our society. But one thing that's important is that it is very important to know is that it's extremely important for digestion to make sure that you can find a place to relax. Now look at some of these health challenges that we have in today's society. A lot of these are related to stress. Interestingly enough, insomnia, weight gain, and then many digestive health challenges do have a stress component to them. Now insomnia, some of you may be familiar with this, where you go to bed at night and your brain does not stop working. Stress related. Another one is weight gain. Let's just say, for example, that you feel a constant amount of stress throughout the day and your stress hormones are up a little bit. For example, like cortisol, which is a stress hormone. Now cortisol is very well known for raising blood glucose. Now, when that blood glucose rises, getting ready to put that glucose into our muscles to either fight or flee. Now, if that glucose is not used for fighting or fleeing, then the pancreas will release this hormone called insulin. And insulin is very well known for telling the body to make and store fat. All right? So this is the stress component with weight gain. It's very well known in science. And it's something to consider when it comes to stress. And then last but not least is digestive health challenges. Now, if we're experiencing stress in general, we tend to be more sympathetic or fight or flight dominant. Okay? Digestion is not going to work as well if we're not relaxed. Okay? Our food may not be fully digested. We may experience things like gas or indigestion. And then if we're not able to fully digest our food, then our nutrients are not going to be as bioavailable. So we're not going to get as much out of our food. So it's really in our best interest to make sure that we're digesting our food well. Now, how can we achieve relaxation? Interestingly enough, this has been very well studied by science. And the ones that I have written here on the top are the ones that are actually very well known. Things like meditation, prayer, biofeedback, if you have access to that, guided imagery, where you lay down and you relax and you think about being in a relaxing place. Any type of exercise. Hatha yoga is very good for relaxation too. Tai Chi and Qigong. Hypnosis is very effective. And then making sure that you get enough sleep. Okay, sleep really helps to reduce your stress level. Very important. Being in a supportive community, cultivating happiness and appreciation for everything that you have in your life. Here in the United States, we're very fortunate to live in a culture where there's plenty. So have appreciation and happiness. And then the one here that I wrote on the bottom is me. Prioritize your to-do list, because I have to say my to-do list is about 5 pages long. So sometimes just looking at that can be stressful. So take care of the things that you need to take care of right away, and then let the other things chill out for another day. It works for me. But anyway, the most important thing is what relaxation technique works best for you. And that keeps your body more in parasympathetic, helps you be more relaxed, so that when you go to eat, you can get the most out of your food. Absolutely. So, while you're eating, here's a couple things to consider. Chewing your food well. Really being mindful of what you're eating, enjoying what you're eating. Really taste your food. Take the time to be very present with what you're doing. Chewing allows your food to mix with saliva, and saliva is where carbohydrate and fat digestion begins, with your salivary amylase and lingual lipase. Those are the two enzymes that get started with carbohydrate and fat digestion. So make sure you chew your food well. Some people forget to do this and they just gulp their food down. One time I went to a macrobiotic conference many, many years ago, and one of the speakers said, chew every mouthful of food 100 times. I would say, after 100 times, I know that I couldn't get to 100 times, but after 100 times, there wouldn't be much left at that point, I have to say. And I think that was what the idea is. And what it comes down to is chew until your food is fully liquid and there's nothing left to chew. This really helps to separate the nutrients in your food from the surrounding fiber and allows them to be much more bioavailable. Like I said before, eat slowly and mindfully. Enjoy your food. Cultivate a sense of gratitude and connection to your food. Know where your food came from. Think of everything that went into the production of that food. Who grew the food? How did it get there? You know, just be aware of that. Food doesn't just come from a grocery store. When I was growing up, that's what I thought. Food comes from the grocery store, but there's quite a bit more to it than that. Another important one is to eat within your means. Eat when you are hungry only. And then when you eat until you are full and stop. And then allow digestion to happen. And then don't eat again until you are hungry again. That way you can allow the full digestive process to take place. Very important things to consider. And then as far as eating late at night, please don't. What science tells us is that the earlier that we eat before going to bed, the better our digestion is and the more restful sleep that we get. I know it's pretty hard in today's society to be able to do this, but please do your best to afford yourself this important aspect of digestion. This will allow you to be fully rested and wake up feeling refreshed. Now, if digestion can be challenging, especially the digestion of raw foods can be challenging for some people, and if it is for you, here are some things to consider. Juicing is very good because it separates fiber from the nutrients and allows the nutrients to be more bioavailable. Blending is very good too, for the same reason. Some people will argue that there's oxidation of the nutrients with blending. There is a little bit. From what I've seen in science, it hasn't been fully studied, so I don't know for sure. My thought, though, is that if you have a choice between eating a Twinkie versus eating a green smoothie, absolutely eat the green smoothie. You're going to get a lot more nutrition out of that than you are any type of processed food, okay? So I don't think of green smoothies as not being beneficial nutrient-wise. They are extremely beneficial. Some other things, with the harder to digest vegetables such as broccoli, lightly steaming can oftentimes help if you're having trouble digesting them. For me, I cannot eat raw broccoli. Can't do it. It just doesn't work. But I love raw broccoli. So what I do instead is I lightly steam it for about 5 minutes, and then I don't have any trouble digesting it. It's just enough to soften that fiber connection with the nutrients, and it makes it much more digestible. So lightly steaming, you're going to lose a little bit of your water-soluble vitamins, but not a whole heck of a lot. So you don't have to worry about it too much. And there's not going to be the formation of any cooked food toxins with light steaming. Okay? So not something to worry about. And then last but not least, food combining. One thing that I've noticed is that eating fruit away from other denser foods really works well for me. Okay? And a lot of people say the same thing too. Because in general, if you eat fruit on top of something more dense, it may cause some form of indigestion. For me, it gives me some gas. So I just have fruit away from other things. As far as the other principles of food combining, take a look at them, try them out. I don't think there's any harm to them at all. They're worth a shot, and if they work for you, great. So if there's any specific questions on digestion or the mind-body connection, I would be very happy to answer them. Yes, in the back.
I have a question about like legumes. Do you ever eat like cooked beans, and if so, when's the best time?
The question is, do I consume legumes? And if I do, when is the best time to do so? I do consume some cooked legumes from time to time. I actually think they're a very valuable food. I do like black beans. I like kidney beans. It's a good idea to not eat raw kidney beans. They have certain toxins in them that are broken down when you cook them. So if you're going to have kidney beans, it's definitely a good idea to cook them. Yeah, I think they're valuable foods, and from what I understand, either steaming them or boiling them, you're not going to have the formation of any type of cooked food toxin. And when do I eat them? I have them maybe a couple times a month at dinner, perhaps. And when I do have them, I have them with a salad. A large salad, I should say. Sometimes I eat them with a little bit of brown rice, too, because I like the combination of the two. But yeah, you know, usually dinner time or lunchtime is probably a good time. Yes, question?
I actually follow up to that question, not that question. Real quick, what do you think about sprouting chickpeas? Are you better off just eating cooked chickpeas or sprouted chickpeas? Or does it depend on you personally?
Okay. The question has to do with sprouted chickpeas. Is it better to cook them or is it better to sprout them? I have found from my own personal experience, and there isn't much science on this, but it's just my personal experience, that sprouted chickpeas are a little difficult to digest, I have to say. But one thing I have noticed is that if I sprout the chickpeas and then lightly steam them for 5 to 10 minutes, they become much more digestible. Okay, so you're going to lose probably a little bit of your water-soluble vitamins in there and maybe some enzymes. But by and large, I think you can get more out of them by actually lightly steaming the sprouts rather than eating them raw. Now, I do eat cooked boiled chickpeas once in a while, but not too often.
And my original question was about IBS. And you were talking about the mind-body connection, and you're talking about digestion under stress.
Mm-hmm.
What have you learned about IBS and it being related to stress, really?
Right.
Just a stress-related disease.
That's a very good question. The question is there a stress component of IBS or irritable bowel syndrome? Interestingly enough, I have been looking at some research on that lately. There is a hypothesized connection from what I have seen. It isn't definitive, just like most science. They have some evidence for it because they have seen that in individuals that it seems to be higher in people that have higher stress levels. But then again, there's a lot of other things that can cause it too. So there may be a stress component, or at least with some people there has been one identified. There was a question, yes, in the green.
You mentioned eating fruit alone or with leafy greens. How would you characterize chia as a food if it were soaked? Can you eat that with fruit?
The question was about chia. How would I characterize chia as a seed or as a food, and how would I consume it? Well, I would characterize it, first of all, as a seed. It's kind of similar to flax seeds in some ways. So as far as eating it with fruit or any other type of food is concerned, if it works for you, great. I've never actually combined chia with fruit, so I don't know for sure. I don't know if it would have any digestive ramifications other than what works best for you. I have had it with greens, and it's been fine with that. Okay. Question in the back. The question was, do I have any ideas about how to take enzymes for optimal digestion? Now, for me personally, I don't actually take enzymes. For some people who have weak digestion, enzymes may be very well a good idea. I know many people who have taken them before and have had good results. In general, If you're going to eat something heavy or cooked, it's probably a good idea to take digestive enzymes if you have weak digestion. So I think a lot of it has to do with your own personal experience. Okay? If it works well for you and if it makes your digestion better, then it's a good idea. Question in the back.
Rather than taking the enzymes as a supplement, you just take a cup of sprouts, and essentially that enzyme action helps digestion.
Well, the question was, can you substitute sprouts for taking actual enzyme supplements, and will that substitute for the action of the enzymes? The answer to that is, sure, give it a try, because sprouts are very enzymatically active, and they certainly would add to the enzymatic activity of the food that you are consuming. So yeah, it would make sense, but I don't know for sure. But nonetheless, it's an interesting idea. Question?
So the sympathetic response is often described associated with fear and danger.
Yes.
But is it also associated with just like physical exertion or mental exertion?
It can. The question was, is the sympathetic response associated with stress and fear, but is it also associated with physical exertion? Yes, it is. So it can definitely be associated with something that's not as stressful mentally, but physically stressful. Like any type of physical activity is going to be physically stressful, although there may not be a mental component to that. Good question. Next question.
And just to add to that also, it can also be a made-up fear in your brain.
Oh, yeah.
Keep running the tape. So it's not a real thing.
Yeah, that's a very good comment, and I want to repeat that. That oftentimes psychological stress can be something that you have made up. It may not actually be based on reality. It might just be a perceived fear, or it might be fear of something that you may think is going to happen in the future, or some scenario that you think might occur. But it may not be true, and it may not come to fruition. So it's another reason to try and be in the moment as much as possible. And another consideration would be to, if you're having that type of thought process, to think of an outcome that's more positive and say, well, geez, it could happen this way, but it could also happen this way too. Oftentimes you get what you focus on too. Yeah.
And then my question was, with the Rejuvelac and the kombucha,
Yeah.
is that beneficial in your opinion out there?
The question was, is kombucha or other fermented types of foods like Rejuvelac beneficial for digestion? Now, any type of fermented food, which is what those things are, can be to some degree because they do have probiotic bacteria that grow in them. Now, I do have some pause when it comes to fermented foods because it has everything to do with where the foods are fermented and the fermentation milieu. Because I know in many fermented foods, not only can there be positive bacteria or good bacteria, there can be potentially harmful bacteria that grow in there. So you have to be really careful with fermentation. I know for myself, I don't ferment very often just because I'm concerned about that. I know some people have had some not very good outcomes because they've had some bacteria get into their fermentation product that they didn't necessarily want. So that's just something to be aware of. Yes?
And lack of nutrients interfere with digestion? Like, for instance, you're not getting enough nutrients from your food, maybe you're very depleted. And what if you get to supplements? You have to take supplements to help with that.
The question was, if you're not getting enough nutrients from your food, can that be affecting digestion? And then should you supplement those nutrients to potentially help your digestion? Generally, yes, that's absolutely true. That's absolutely true. As far as supplementing goes, the best thing to do would be to get an evaluation. There are digestive evaluations that you can get through labs like Genova Diagnostics, which used to be called Great Smokies Diagnostic Lab. Another one is Metametrics. Generally, these types of tests can be done with a practitioner, like a medical doctor, for example, who practices functional medicine. And they can do a full digestive evaluation to see if that is an issue. That would be something that would be beneficial to find out if that is a situation for you. Yes?
Could you talk about just a kind of optimal way to deal with post-gallbladder surgery?
Okay, good question about how to deal with post-gallbladder surgery. Now, essentially what the gallbladder is it stores bile that is made in the liver. And bile is very important for fat digestion. And the gallbladder is very important because since it stores this bile, when you consume a high-fat meal, that gallbladder contracts and releases all of that bile to help with the digestion of that fat. Now, if you have your gallbladder removed because of stones or some other reason, then the bile that is being made in your liver is not being stored anywhere, and it is just consistently dripping from your liver into your small intestine. So in that case, generally what a physician will tell you is to eat smaller meals throughout the day. High fiber meals, lower in fat, so that you don't have too much fat or fat in excess in your diet of what can be emulsified by the bile that is dripping from your liver into your intestine. That's generally what they tell you. In a situation like this where the gallbladder has been removed, it's important to work with a physician who can monitor your situation and give you advice based on your own individual needs. Any other questions? Yes?
Can you speak a little bit about the role of cleansing, juice fast, water fast on digestive health?
The question is the role of the role of cleansing and juicing, or juice fasting, juice feasting, or whatnot, on digestive health. There's not a lot of science behind it, but people have told me that after they've gone on some type of cleanse or some type of juice fast for a period of time, that their digestive system works better. And I can only hypothesize to say that maybe it has something to do with the digestive system getting a bit of a rest, a much needed rest. And maybe somewhere along the lines is like pushing the reset button to allow things to work better. It's really just a hypothesis at this point. There's not a lot of science on it, but nonetheless, if it works, then hey, it might very well be a good idea. So we'll take one more question.
Thank you. What's your take on probiotics, and why would someone need to take like 5 billion CFU as opposed to 45 billion CFU?
Okay. The question is on probiotics. And are probiotics good for digestion? The answer to that is, according to peer-reviewed science, apparently yes. It's amazing. Actually, in the past couple of days, I've taken a look at quite a bit of research that talks about how beneficial probiotic supplementation can be for various digestive health issues. Once again, though, if you are somebody who has unique biochemical situations such as immune compromise, then it's a very good idea to work with a competent practitioner who understands probiotics and how it might affect your immune system. As far as how much to take, I guess the gold standard in natural health is about 5 billion per unit, I suppose. I don't really know what the difference between that much and maybe a little bit less is. For some reason, that is what has been studied, and that is what is seen as being most effective overall. But that's really, I guess, just what I know at this point, and my level of knowledge with that is really only beginning. But there is quite a bit of research that I have seen on that, and it's actually very encouraging. So I want to thank you all for coming. If you have any other questions, I'd be happy to take them up here.